I'm Nathan Boyer. I am an orthopedic nurse practitioner. I work at CommonSpirit Health in the orthopedic specialty department. I've been in healthcare for over 20 years. I started out as a regular nurse working in the hospital on the floors on various departments, including the emergency room and the intensive care unit. Over time, I felt like I needed to do more for people, and so I went back and got more education and found a good fit in orthopedics, largely because I enjoy the idea of working with people and helping them stay active, specifically in helping them do total joints, specifically total hips and total knees. So I feel CommonSpirit is very much a community organization, and they want to outreach to people to help them achieve their health goals. I find that very helpful because those are some of my same goals. I want to see people stay very healthy and active throughout their whole lifespan. So I feel that patients should be the captain of their ship. They are the ones that get to decide how we get from point A to point B. This is, of course, based upon their health goals and exactly where they want to end up. My job in this process is to be a really good first mate. Based upon those goals and desires of how to get there, my job is to make good recommendations. I never try to set just one plan that works for everybody because I know people are all different and goals change. Throughout the process as I'm working with patients, we try to decide which plan is going to work best, whether it be plan A, plan B, or even plan C. The goal ultimately is to get to your destination and have as smooth a sailing ship as possible. A patient can expect a very thorough assessment so that we can officially diagnose exactly what the problem is. This may also include diagnostic tests, including x-rays, to begin with, but it may also include things like an MRI, a CT exam, or even lab work if necessary. Once we have the results of all of these diagnostic tests, it makes it much easier to create a plan based on real diagnoses. The most important part is a follow-up, because once we have a plan in place, we need to make sure that it's working. If it's not, we might need to make some adjustments to that plan. In the end, we want you to get better so that you can achieve all your life goals. I am well known both in my family and among friends to be a mountain biker. Don't be surprised if you see a few skinned knees on me every once in a while because of my latest adventure on a bike. But in general, I love anything that can be done outside. I'm known for skiing and fishing, for camping, backpacking. I frequently go boating with family and friends. In general, if it can be done outside, that's where I'll be.